Hi, everyone, and welcome to the Live Better, Feel Better Advent Health Podcast. I'm Victoria Dunkle, and today we're talking to our director of the Baby Place, Chloe Harden. Chloe, great to see you.
Thank you. Great to see you too.
It's nice to see you here in a comfortable setting where we're not seeing you running around at one of the busiest labor and delivery hospital areas. Yesterday we were over there, and I think I heard the lullaby playing overhead at least 4 times.
Yes.
We should probably tell people what that means. So we play the lullaby. What happens when we hear that overhead on the speakers?
When you hear the lullaby overhead, it just means that we had a delivery for the day. So if you hear it 4 times in a day, we've had 4 deliveries that day. And a lot of times we do not play it at night, so we can respect people's sleep. So if someone delivers in the middle of the night, we'll play it for them the next morning.
Oh, that's sweet. So, now, I heard 4, and I left at lunchtime, so who knows how many more babies were coming into the world. But that's what the Baby Place is all about, isn't it?
Yes. It's great. Great time to celebrate life. So
you really do a great job of celebrating that. Tell us a little bit about what the Baby Place is like.
The Baby Place is family-centered, so during your whole labor delivery process, you can have your support person with you after delivery. You know, as long as baby's looking good, it doesn't need any extra care. It goes immediately skin to skin with mom, so you have that time to cherish with your baby. Anything that we need to do for baby, vitals, just checking on the baby, we can do that right on mom. So we try to keep the family together as much as possible.
And when I talk to moms who've had their babies with us, they just appreciate it. They feel like you've become part of their families, just caring for them on such a high level of compassion. We were talking a little bit here about some of the things that make the Baby Place so amazing. It actually keeps consistently earning that People's Choice as the best of Blue Ridge, favorite place to have a baby kind of situation there. So you've got to be doing something right. Let's talk a little bit about the safety of the moms and babies that really drives all you do. Tell us some of the things that the Baby Place does to ensure mom and baby are safe.
First of all, we have OB hospitalist group. So they are providers that stay on the unit 24/7. So they are there all the time, anytime an emergency arises or a patient comes in. They're there to see that patient. Mm-hmm. We also do daily huddles and nightly huddles. So we talk about the patient among the whole group with pediatrics, the doctor and the nurses, even lactation. So we make sure everyone's on the same page. We also have started a new initiative.
What's that?
So our new initiative, we give postpartum bracelets.
I was wondering what that bracelet was about.
So I brought one to show. It says AdventHealth on one side, and on the other side, it's postpartum. So we pick colors. So postpartum is in pink and blue for boy, girl.
Yeah, you covered all the bases here.
And then AdventHealth. So we educate our patients on discharge to wear these bracelets up to 6 weeks postpartum. That way, if anything happens, increased blood pressure, increased bleeding, any kind of signs that we tell you to call 911 for. We've also educated Henderson County EMS to watch for these bracelets so they know if a complication arises. It could be due to postpartum complications and not just any normal complication.
That's kind of really interesting because you're right. Postpartum, there are things that can happen that you are educating moms on, but then say, God forbid, mom is unconscious. What a great way to make sure the message gets to the people who are responding and taking care of her in that instant, in that immediate moment. You said you've been talking to the EMS about this, and it's Henderson County. You're also speaking to those in Buncombe County and beyond. Tell me what it is their response to knowing that we're doing this for our moms.
They're very excited. They are aware that some moms may take it off, but also to ask family the question. So for them just to notice the bracelet and, it clicked that, hey, something may be postpartum happening with the mom. They're very excited.
And to be able to know that earlier in the situation, how does that give mom a better chance in the choices of treatment and the way we're caring for her?
There's different guidelines for, postpartum. So it initiates treatment quicker. So you know what to do. Of course, there's guidelines on how to treat postpartum parents. So this helps jumpstart and treat quicker and prevents further complications.
Wow. We really do make it our priority to keep mom and baby safe. Let's talk about keeping babies safe too. You mentioned that we have OB hospitalists. They're here 24/7. So say mom's primary OB is maybe out of town, unable to make it when mom goes into labor. stuck in traffic, as we've seen,
Yep.
right, with all the great construction on the roads. But that means we've got that hospitalist there to help mom and to deliver the baby in any situation. But let's talk about what we're doing for baby. There's a great project in the works.
Yes. So we have a great project in the works coming soon. We will be working on a NICU. So it will be a level 2 NICU. Right now, we care for pregnant moms that are 35 weeks and up, and it will be lowered to 32 weeks and up. And we'll be able to care better for the infants. Right now, we just do nasal cannula support. Once the level 2 opens, we can do ventilation for 24 hours and then CPAP. So more support for baby, and that means we get to keep the babies here.
Well, and keeping the babies here is really important because what kind of additional stress does transport cause to a newborn or a sick infant?
A lot of stress, not just for the infant too, but for the family, because not all the time you can transport the mom at the same time, especially if they have a C-section. So just keeping that family together is great. We're going to have 3 rooms that are private rooms. So even after mom is discharged, she can stay in that room with the infant. So
Love
that's
it.
something that will stand out as well.
And then we'll have 2 other observation beds for those NICU level of care for babies. What are some of the things that lead to the need for NICU, or things that a mom might currently be hearing that would require her to go to another hospital? Not her first choice. We have so many moms saying,
Yeah.
I want to deliver at the baby place. I love the way you helped me with my first child, or my friend had a baby here. But then they find out that maybe there's a situation that would require them to have to be in a place where they can get that NICU care immediately. What are some of the situations that would put a mom into that place where she has to make that decision?
A lot of them, I would say, is just preterm labor.
Okay.
Right now, again, we can only do 35 weeks and up. So a lot of those that we transfer are preterm labor, and we have no NICU in Henderson County. So we do have to ship those parents out. Other complications could just be, preeclampsia that is getting severe that we can't keep, and again, lower gestation that we can't keep and keep those babies safe.
You say that this will be the only, right now we don't have a NICU in Henderson County.
Correct.
Let's talk a little bit about just what got you into being now the director of the baby place, but you have been part of this team for a long time. But tell us about how this all happened. Did you know you wanted to be an L&D nurse?
Yes. I've always wanted to be an L&D nurse. My first passion was to be a CRNA, but I always knew I wanted to do L&D.
Okay.
But once I got into labor and delivery and actually got to help the moms through labor and take care of the mom and baby afterwards and just comfort them, not even, just times of happiness, but also sadness, because, moms do lose babies. So just being there for both that joy and the losses changed my mind. And I just wanted to help patients better, and being a leader and the director, I feel like I can help guide the care better. So
let's go a little deeper into this, because I know a little bit of your backstory in the sense of how long have you been part of the AdventHealth team? And let's talk about how you've been able to realize those dreams with some of the programs here that we offer to our team members.
I've been to Advent a little over 18 years now. I started as a CNA, so I was a CNA for 3 years on the behavioral health unit. I then became a nurse on behavioral health, and then started again. I worked tele because I wanted to be a CRNA. And then once labor and delivery opened, I went for it because that's something I was always wanting to do. And once I started there, I didn't turn back.
And we're so glad you didn't, because it's such an amazing, I've been able to work with you 10 of those years now, and it has been amazing to see all of the things that are happening and the ways that we keep raising the bar on the parents, for parents with safety and care options, and the compassion your team provides. Let's talk a little bit about a new accolade for your amazing team. You sent me an email about a week ago with a new reason to shout it up from the mountaintop. So what's going on? What did your team just earn?
So we just earned the Safe Sleep certification for the hospital. So what that means is that we educate our patients not only in the baby place, but emergency room, anywhere that has patients that are less than 1 year of age. Just educate them on safe sleep, back to sleep, no heavy blankets or toys in the crib, things such as that.
And I know that it seems like for some people, we hear about that all the time.
Mm-hmm.
But we hear about that all the time for a reason. This still continues to be a major issue
Yes.
or risk for babies when we take them home.
Yes, major risk for SIDS. And then, of course, you have a baby, but then your great-grandmother, I
Mhm.
always laid my babies on their stomach and they were fine. So just going through that and educating those grandmothers and great-grandmothers and family is very important.
Making sure everyone knows how to keep
Yeah.
babies safe. That's
Yes.
terrific. Um, okay. You also, on top of it all, are a wife and mother. You've got
Yes.
how many kiddos?
I got 2 boys, 9 and almost 12. He'll be 12 next week.
And so
They're full of
busy at
energy.
work and busy at home.
Yes.
I'm a mom too. I'm married. It's a juggle. How do you keep it going? Because you really bring a love and energy to your job that is admirable, and people aspire to be as connected as Chloe.
Oh, thank you. I don't know. I just try my best. We'd like to do things as family, go camping. My youngest plays football. My oldest is just getting interested in guitar, so he's taking lessons.
Wow.
Just doing outdoor things. We have a big garden every year. We like to go ride on the side by side on trails through the woods. Exercise is important. Just doing a lot of things as family.
And for other people in the healthcare profession,
Mhm.
other working folks who are, what are some of the things that you do that are a priority for your self-care? How do you make sure when you are in a job, especially where you care for others so much, how do you make sure you are taking care of yourself so you've got that ability to pour that care into others?
Sometimes it can be difficult. Just reminding myself that I do need to take care of myself, whether it's go to for a walk, try to do some kind of exercise in the basement, try to get my kids to also participate. Definitely eating healthy, and then also just going to church and being present with God.
And your team members, you share and lead by example for your team members and stuff. I happen to
Mhm.
remember bumping into you one time, and you were talking about how you were encouraging your team members to join you at the gym and so on.
Yes.
You do really pour into the team as one of our exceptional leaders here. What are some things that you do to make sure your team feels connected to you and understands that you are a resource and ready to serve them as well?
I do daily check-ins with my staff. Night shift is a little harder, so I do come in at least once a month to try to check in with them. I think I was here bright and early at like 5:30 yesterday morning, just to check in with those team members. I encourage doing outside of work activities, like whether it's zip lining or some kind of team building, so that we're all connected. And then also just having not only staff meetings, but then also having another meeting with the charge nurses and my managers just to make sure everyone's on the same page, and then that we connect also outside of work.
18 years with this organization.
Mhm.
What makes you someone who can say, "I've worked here for 18 years"? Why have we been able to be blessed to keep you this long?
It's just an environment and the people. Everyone's great. You walk around, you may not even know them, and they're smiling and asking how they can help you. So yeah, just the people, the culture, my team. Everyone's been wonderful this whole 18 years.
What's next?
What's next for me? Um, just continue to lead my team, try to make the baby place the best place ever to deliver, and also drive that with the NICU. That's something that I'll be learning because it's new to me. I can take care of sick infants, but going down to 32 weeks and just learning the different things with more premature babies.
And I've been in on the task force and the team, the committee that's been put together for this, and I've seen how you and your other team members are collaborating with the physicians and with our neonatal nursing team and hospitalists to just learn and be the best at it. I'm so excited for all you've done so far to become that team and all you're going to continue to do. Chloe, you get to see and welcome our newest patients all the time, and you get to love on the parents and the family as they welcome new babies into their worlds. We thank you so much for all the joy you bring to those families, but thank you so much for all the joy you bring to us as team
Oh,
members too. I
thank
love
you.
being on a team with you. You're
Thank
awesome.
you. You too.
Thanks. That's going to do it for this edition of Live Better, Feel Better, the Advent Health podcast here. I'm Victoria Dunkle, and I invite you to join us and follow us for the next edition, and also check out the links we're going to share when we post this for you.